There's lots of things that patients can do before surgery to make sure that they're going to do better afterwards. One of the things that's really important is to start watching what you eat and also trying to exercise more. And by doing this, you'll get into better cardiovascular shape, so you'll be able to get on your feet a lot sooner after surgery.
Over a month period, I lost 15 pounds, laid off the red meat and the carbohydrates and a little bit of exercise.
Diet is very important. I really will talk to you about trying to watch out for your breads, rices, pastas. We just want to really reduce the amount of carbs that you eat, and all that will help you lose weight. And with less weight, you're going to have less tissue that is going to interfere with us doing the surgery. Another thing that we'll talk about are Kegel or Kegel exercises, and that's a way where you can improve the strength of your pelvic floor. And the stronger your pelvic floor, the less time you're going to spend dealing with problems with urinary leakage. We're going to make sure everything's taken care of before surgery. The scheduler is going to talk to you about setting up a time for surgery based on your schedule and mine. We're also going to make sure you have all your prescriptions so you don't have to fill them afterwards. You'll be able to fill them conveniently before the procedure takes place.
We ask all patients to get off of all blood thinners a week prior to coming into surgery. They will receive a list of all the medications they shouldn't be taking, but some very common ones are Excedrin, Advil, Motrin, a majority of their vitamins. So just 7 days prior to their surgery, we ask that they remain off of all blood thinners just so that we don't have excessive bleeding during or after their surgery.
The hospital will be in touch with you. You'll be able to see the hospital if you'd like to.
We're here to assist you in getting ready for your surgery with Dr. Kella. We'd love for you to come in. We'll be happy to show you your room, take you on a little tour of the hospital. Ultimately, what we want you to do is to feel comfortable when you get to our facility.
If you're coming in from out of town and need accommodations, we have great places that are close to the hospital, which we can get you in at a preferable rate. So as we get to the time of surgery, it'll be important for you to be in town the night before surgery. The night before is when you'll do the bowel prep. The bowel prep usually takes a few hours to do, and it's best just to be in a nice, peaceful location while you go through the final preparation for surgery.
Well, the day before, I was on a clear diet, and I was required to take a cleansing solution. It was about 12 ounces. It's like a citrus flavored 7-Up drink, and followed by enema later on that evening, and nothing to eat or drink after midnight.
The next day you'll come in depending on the time that the scheduler has given you.
We highly advise all of our patients to arrive 2 hours prior to their scheduled surgery time, and this is just to go through some very basic general registration processes. We need to get a copy of their driver's license and their insurance cards, and we also just have some basic paperwork for them to go through, and then of course their pre-surgery preparation. So 2 hours early usually keeps everything right on schedule.
We'll have a chance for you to meet the nurses in the OR. They're going to make sure we have all the paperwork in place. They're going to make sure that you and your family are comfortable. You'll also meet the anesthesiologist. The anesthesiologist will tell you how their part of the case goes.
Dr. Kella told me, that I was going to take a sedative prior to going into the operation room, and it would relax me, and basically I wouldn't feel anything. I only remember saying goodbye to my family and the ones that were around, and after that I don't remember anything till I got to my room.
We're going to make sure you feel as comfortable as possible before we go through with the surgery. So on the day of surgery, I'll meet with you, I'll meet with the family. Whatever questions you may have, we'll go through and make sure you understand everything. And that way you'll just feel as comfortable as possible